So let's talk some ortho here. So let's just first talk about the need for orthodontics. Um, let's just talk about different bites. Um, let's see here, bites for orthodontics. Okay, so let's just do this one right here. So the first bite would be, let's bring it up. Here we go. First bite is what we call an open bite. So open bite is basically the back teeth are touching, but the front teeth are not, hence open bite. This is called crowding. This is the teeth when they're crooked on the top and the bottom. Sometimes we'll say severe crowding. It's really, really crooked. This is excessive space. Sometimes patients will have too much space. The reason why they'll have space is either one, the shape of the teeth is not correct. The teeth are too small. Genetically, some people are born with small teeth. Or the teeth are totally normal, and because of a very big tongue, their tongue pushes forward as they swallow and it opens up space between the two front teeth. We call space between the two front teeth the diastema. And with diastemas, let me just Google diastema. Here we go. So here's a diastema. Here's someone with a diastema. You can see they have a strong space between their two front teeth. And studies show that with diastemas, when you close the diastema, if they don't wear a retainer, it's going to open back up. And it will come back really quick. So you can see here, here's a bunch of famous people that have diastemas. But let me retainer, I'll show you here. So typically what we do for a diastema is when they are done with treatment, let's see, you can see it right here. When they're done with treatment, we put a little glued-in retainer behind their two front teeth. That's almost standard, mandatory when you have a diastema. So getting back to the different types of bites, we have here called a cross bite. You can see the back teeth. Do you see how the top teeth are inside the bottom teeth? Versus like right here. Do you see how this is on the outside of the bottom teeth right here? Right here, you can see that's on the inside. We call that a cross bite because the teeth are across or crossed over. This is a cross bite in the front. We call that an anterior cross bite. This is called a deep bite. What makes this a deep bite is you see how you can't see any of the bottom teeth? Look like right here. Like right here, you can see the bottom teeth. That's not a deep bite. That'd be more what we call an edge-to-edge bite because the teeth are topping on top of each other, edge to edge. Whereas down here, you can see that the bottom teeth are actually trapped behind the top teeth. We call that a deep bite or an overbite. This is called an ectopic eruption. Anytime you have a tooth that is coming in a place, in a position that's out of the normal, really high up, we call that an ectopic eruption. This is called overjet. This is basically like bucky teeth. When the teeth on the front are too far forward, we call that overjet. Now, studies show that when you're a kid, 4 or 5 years old, and you have a lot of overjet, when you fall, you're more likely to land on your front teeth and crack your front teeth. So that's one of the reasons why we'll do treatment in young kids, is because we want to bring those front teeth back, reduce their overjet, make it so that when they fall, they're not going to crack their teeth. Here is, again, this is what we call crossbite. The front teeth are behind the bottom teeth, but another word name for that is called an underbite. So those are all the different types of bites that we have. Now let's talk about dentitions. Dentition, teeth. There's a couple different types of dentition. A dentition is humans get 2 sets of teeth. They have their baby teeth, and they have their late adult teeth. So let's say mixed dentition. What does happen is sometimes, or not sometimes, but always, when you're like 4 or 5 years old, you'll lose your bottom teeth. You lose your bottom teeth. Here we go. You'll lose your bottom baby teeth, and the permanent teeth will come in. And when you have permanent teeth with baby teeth, we call that mixed dentition. Dent stands for tooth, mixed teeth. You have permanent teeth down here, baby teeth on top. Now there's different types of mixed dentitions. We have early mixed dentition, when they're young, about 4 or 5 years old, when they start getting their permanent teeth in the front. And then we have the late mixed dentition. Now, the late mixed dentition is after, when you're about 11 years old, you will lose 12 baby teeth within a year. And we call that the late mixed dentition. So those are different types of dentitions. We talked about different types of bites. Let's talk in more detail on the bites. Class 1 bite or malocclusion. Now, one of the names for teeth coming together is called occlusion. It's how your teeth, top and bottom teeth, come together. Occluding, biting down, it's all the same word. A class 1 occlusion is actually a really healthy occlusion. It's when the top teeth and the bottom teeth have, here we go. It's when the top teeth and the bottom teeth, let's see if I can find it, this one right here. The top teeth and bottom teeth, they interdigitate with each other. Do you see how this tooth is in between these two teeth and this tooth is in between those? And you can see how the top and bottom teeth have a little overlap. That's called a class 1 bite. A class 2 bite is when the bottom teeth are too far back. You can see how the teeth are on top of each other. Front teeth are sticking out more. A class 3 bite is when the bottom teeth are sticking too far forward. You can see how this patient has, what did we call? An underbite. We just talked about that. It's called a crossbite in the front. An underbite, another name for this is called a class 3 bite. Both class 2s and class 3s are not healthy because you can see the teeth are hitting on top of each other, versus the class 1, you see the teeth are perfectly in between each other. Let's see here. Another thing is, we talked about bites. Let's talk about the sizes of the teeth. So when you're looking at the teeth front on, let me just go close this door here. When you're looking at the teeth front on, you will see, you'll see, here we go, here's some teeth front on. This patient's actually missing teeth. But when you look at the front teeth, we call the front teeth the incisors. That stems from the Latin root to cut, scissors, incisors, incisors. It's the same Latin root. But the incisors cut meat. They're sharp, they're thin, and you can actually cut through things. But the front ones are called the central incisors, and then the ones on the sides are called the lateral incisors. And when you look at the incisor, you can see here that the incisor has 4 different sides to it. It's got this side over here. It's got this side towards the middle. It's got the top side, and it's got this bottom side. Well, in orthodontics and in dentistry, we label those sides differently. We wouldn't say right or left. You could say that, but what we say when we're looking at the different sides of this one tooth here, we call the side that's toward the middle the mesial, the medial, mesial, it means middle, so the side that's closest to the midline or the center or the middle of the face. We call this edge down here the incisal edge or the cutting edge, the incisor edge. That's where that actually connects with the teeth. We call this edge or this side the gingival side because it's close to the gingiva, the gums. And we call this side the distal side. Distal means back. And so this side right here is closest to the back of the mouth. This is closest to the middle. We call that mesial, distal, incisal cuts, gingival, close to the gums. So let's say we're going to look at this patient's teeth right here. What is this surface right here called, this side? Incisal. It's the incisor, incisal. It cuts. What do we call this one closest to the middle? The mesial. What do we call this one that's closest to the back of the mouth? The distal. And then what do we call the side that's closest to the gums? Another name for gums is gingiva, the gingival side. So you've got incisal, mesial, gingival, and distal. Now all teeth have that. So here we go. Let's look at this tooth right here. This is the front of the mouth is over here on this side. So that's this side of the tooth would be called the mesial side. This side of the tooth is actually called the distal because it's in the back of the mouth, distal. This side right here, we call that the buccal surface. So if you go back to this tooth, this whole surface right here is called the buccal surface. So we've had our sides that I told you about, and then the surface is called buccal right there. And why it's called buccal is the inside of the cheeks is called the buccal area, and so the buccal of the teeth is the part of the tooth that touches the inside of the cheeks. So you can see here, that's the buccal, 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 buccal. This down here is the gingival side that's closed, that's on the buccal surface. Does that make sense? So this is the gingival side of the tooth. This is the buccal surface. This is the incisal edge. That's where the teeth get cut. This is the mesial of the tooth, and this is the distal of the tooth. So what do we call the side that's towards the tongue? We call it the lingual surface. Lingua is tongue. So if you look, all this on the inside of these teeth is called the lingual surface. So let me just type lingual surface. Lingual surface. You can see here, this patient, there's her top teeth, bottom teeth. This is the buccal side of the teeth because it's on the side of the cheek, the buccal. And the inside, they're cleaning off the inside or the lingual side of the tooth. You can see here, again, the side that touches the tongue, that's called the lingual. The side that touches the cheek is called the buccal. Here we go. This is looking at the teeth from kind of bird's eye view on the top. They're cleaning the lingual surfaces of these teeth. They're putting a lingual retainer in here. So let's look at this tooth. Let's look at these teeth right here. So this edge right here, this line that cuts, it's the incisal edge or the incisal edge. This is the lingual surface of the incisors. This over here is the buccal surface of those molars. Down here is the gingival margin of the teeth. On the inside, this is the lingual surface by the tongue. Down here is the gingival line. Here's the back of the tooth. The back of the tooth is called the distal. The front of the tooth is called the mesial. And molars have a bigger surface. Do you see how here in the incisors, it's like an edge, incisal edge. It's a cutting surface. The back of the teeth, they don't cut, they grind. And another word for grinding in Latin is occlusal, like occlusion. So we call this the occlusal surface of the tooth. So a couple different things. We're going to call it a lingual permanent retainer. That's a retainer on the back side of the front teeth. A buccal turbo. A buccal turbo is when you place a piece of glue on this surface right here. Buccal occlusal turbo is where you place it, and you'll see videos on this. But those are the different surfaces of the teeth. Then the next thing is we call the teeth the numbering system for orthodontics. So when you look at the teeth from the front, let's see if I can see. I'm trying to get a better video picture here. Mouth, let's see. Okay, here we go. So, okay, here's the front of her mouth. That's the middle of her mouth. That's the back of her mouth. So starting from the middle and going back, we number it. This is the upper left 1. So tooth number 1, 2, 3, 4, 5, 6, 7. On this right side, it's 1, 2, 3 that you can see. On the bottom, what can you see? We can see right here, that's the bottom left 1, 2, 3, 4, 5. So that's how we number the teeth. So in orthodontics, when you're looking at the teeth, we have these front teeth, which is the central incisors. Those are teeth number 1 because they're in the front on either side of the midline, 1. Then we have the lateral incisors. That's tooth number 2. Then we have the canines. Those are 3. Then we have the first premolar and the second premolar. Why do we call it premolar? Because it's before the molars. And then we have the molar. That's the first molar, second molar, and third molar back here. So the teeth 1, 2, 3, 4, 5, 6, starting from this front over. Okay. Now looking at a different view here, you can see. Let's see here. Here we go. Perfect. There's a bunch of different numbering systems in orthodontics. So I'm going to try and show you the numbering systems. The one that we use is the one upper right, 1, 2, 3, 4. Here's another way to look at it. So if you put the teeth in the top, right, 1, 2, 3, 4, 5, 6, 7, 8 on both. Does that make sense? Let's see here. Types of human teeth. Let me go grab a tegodont. So here we go. So this is the front teeth like this. You have 1, 2, 3, 4, 5, 6, 7. On this side, 1, 2, 3, 4, 5, 6, 7. So it's the upper left, 1 through 7, upper right, 1 through 7, and by the bottom, it'd be lower right, 1 through 7, and lower left, 1 through 7. So test. What tooth is, let's see, typodont teeth. So what tooth, let's see, what tooth number is this? That's 1, the upper left 1. What tooth number is this down here? That's the lower right 3. So 1, 2, 3. What's this tooth right here? That's the upper right 3. 1, 2, 3. What's this one right here? That's the upper left 2. So you hear me say, we're going to bond 7s. What that means is you bond these teeth back here. Those are the 7s. Tooth number 7. Here we're going to bond 6s. These are the 6, tooth number 6. We're going to bond 5s. That's tooth number 5. We're going to bond 4s. We're going to bond 3. Or we're going to bond 3 to 3. What that means, lower 3 to 3. We're going to bond from the lower canine over to the other canine. We're going to bond lower 7 to 7. That's this lower 7 to the other 7. All of them. Does that make sense? So that's a little bit about orthodontics. Now, let me show you something also about orthodontics. Nasal passage, maxilla. So there's something else I'm really passionate about is human anatomy. And when you look at the skull here, you can see this is the front skull here. Well, you can see these are the eyeballs. Here's the nose. Here's the teeth. You can see that the roof of the mouth is also the floor of the nasal cavity. So if the nasal cavity, which is the nose cavity, is too narrow, from here to here is too narrow, then it's difficult for the patient to breathe. So what you can do in those cases is you expand the roof of the mouth with a palate, with an expander, and that expands the floor of the nasal cavity. Does that make sense? So that is something that we also do. You'll see me place expanders in little kids, and what I'm doing is I'm increasing the size of their internal nose so they can breathe better. You won't see it on the outside of their face as we expand. It's more on the inside of their face.